from Hypnosis Authority here in Brisbane. We apologise for the quality of this video. However, please recommend to your smoking friends they should watch this. It's for your smoking friends and you if you're a smoker yourself. It's an important message, and once again do apologise for the poor quality of this video. Thank you. Cilia are those little hairs in the airways, and they keep and filter everything out, but they get glued down with the chemicals in the smoke, tobacco smoke, which that contains the hydrogen cyanide, ammonia, hydrogen cyanide. I think they use that in the gas chambers. Ammonia, as a cleaning fluid. Nitrogen dioxide, is that laughing gas? Not sure. Formaldehyde, now that's one of the chemicals that is an embalming fluid, yeah, so anyway, these chemicals, they actually paralyse the cilia, little tiny hairs on the cells lying. Now what that cilia does, it normally wants to clear the mucus and anything that deposits on them. So basically smokers' lungs are more sensitive to cancer-causing chemicals because their cilia, the little fine hairs there, they're glued down with all the tar. So the airways are not cleared effectively. Well, the tar, that's the mixture of the gases and particles inhaled when the smoker draws in on the cigarette. It contains a large number of chemical compounds. Tar is a mixture of the gases and particles in hydrogen and carbon dioxide, all these gases, and of course carbon monoxide's in there too, which we know people commit suicide, don't they, with the emissions from the car engine. So a number of known carcinogen. Tar is the sticky brown substance which can stain smokers' teeth, fingers and teeth, and also dangerously the lung tissue. And that's one of the things when the tar settles down, it's not very good at all in the body. So now let's talk about low tar cigarettes. So that sounds a good way out for smokers, hey? Anyway, many smokers are changing to lower tar brands in an attempt to reduce their exposure to the dangers of tying cigarette smoke. Makes sense. While this is a step in the right direction, low tar brands may provide a false sense of security. Reducing the tar content reduces the risk of the lung cancer to some extent, but there's little evidence to show it will reduce risk for other tobacco-related diseases. There's an article, if you want to check it out yourself, it's published in the Choice magazine. It was August, it was 1993, never mind. But this exposed the fact that the tar content stated on the cigarette packs may be highly misleading, and many people change their smoking habits to compensate for the lower tar in their cigarettes. By inhaling more deeply or increasing the number of cigarettes smoked each day. So the benefits of smoking low tar brands are minimal compared with giving up cigarettes altogether. And by the way, when we talk about giving up, that's a good word coined by these cigarette companies, isn't it? Giving up. Because we don't give up anything. We taught from children not to give up. We taught to do it to the end. We don't give up things. So it's a good psychological page for you, giving up something away. The single most effective way of reducing this deterrent effect of smoking is to stop completely. There is not a safe level of smoking cigarettes. Yeah, I'll go along with that. I've been teaching it for 40 years now, how to help people stop smoking, and I'll go along with that. So we had a look at the tar, and we looked at the chemicals. Let's have a look at nicotine in detail. So nicotine is the drug in the tobacco which causes addiction among smokers. It is a highly toxic chemical and is often used in industrial pesticides. Nicotine has a number of direct effects on the body. First, it stimulates the sympathetic nervous system, increases the heart rate and blood pressure, and causes constriction of the small blood vessels under the skin. Effects of nicotine, but in the long term, nicotine may be a factor in causing coronary heart disease. This is an early study, and these days now we do know that it's not a factor. We know it does actually cause coronary heart disease. Also, it's implicated in the cause of reproductive and gastrointestinal disorders. Yep, it's strongly linked with the development of cancers. So if you smoke, it's very strongly linked with the development of cancers, and you know that anyway. But the idea is of this is just to have a look what's in the cigarette. This is what this whole video is about, because when you say there's 4,000 poisons in cigarettes, it's just a figure to smoke. It just glosses over it, glassy-eyed. But when we have a look at half a dozen, or as we have here, 30 odd different ones, we find that a lot of them are not healthy. And you recognise some of them. I'm sure you recognise ammonia. I'm sure you recognise formaldehyde, which is used for funeral parlours. For embalming, it's an embalming fluid, isn't it? And what about carbon monoxide? CO is an odourless, tasteless gas, giving no warning of its presence in most circumstances, and in large amounts it's rapidly fatal. So this is your carbon monoxide for you. Carbon monoxide has a chemical affinity for hemoglobin over 200 times greater than that of oxygen. It binds perfectly with the hemoglobin, thereby reducing the amounts of oxygenated blood circulated to the body organs and tissues of coronary heart disease. So there we go. So these days, cigarette packets must have a labelling on them, a government health warning, which is a good idea. However, they've got all these gruesome, awful faces on them, eyes falling out and mouth cancers and teeth falling out, which are all true. But any self-respecting smoker would not see those things. He would go down to the shop and buy one of those lovely packets with all the lovely designs on, he or she, and pop these cigarettes into these lovely packagings. It could be gold or silver boxes, whatever, and they just get on with their smoking. So that's okay. But let's look a little bit more seriously now about the lung cancer. We know that tobacco smoke contains many cancer-causing chemicals, including tar. When you breathe the smoke in, these chemicals can damage the lungs, seriously damage the lungs, and can cause cancer. Now, lung cancer is the most common cancer caused by smoking. It causes other cancers, but it's the most common cancer caused by smoking. And lung cancer can grow and spread before it is noticed. Did you hear? Lung cancer can grow and spread before it's noticed. It can kill rapidly. So hopefully when you listen to this and watch this video, it may help you to understand what these lung cancer chemicals do to you. It can kill rapidly. That's the cancer side. What about the heart disease? So tobacco smoking is a major cause of heart disease. It can cause blockages in the body's arteries. This is common. These blockages can lead to chest pains and heart attacks. Heart attacks is the most common cause of death in Australia. Did you hear? Heart attack is the most common cause of death in Australia. This is serious. And smokers run a far greater risk of having a heart attack than people who don't smoke. And this is a fact. Smokers run a far greater risk of having a heart attack than people who don't smoke. In Australia, tobacco smoking causes more illness and early death than using any other drug. Tobacco smoking causes more than 4 times the number of deaths caused by car accidents. Smoking is very addictive. Nicotine, a drug in tobacco, makes smokers feel they need to smoke. The more you smoke, the more your body will depend on getting nicotine, and you may find yourself hopelessly hooked. It may be difficult to give up once you are hooked on nicotine, but we do have remedies. Smoking when pregnant harms the baby. Poisons in tobacco smoke reach your baby through the bloodstream. If you smoke when you are pregnant, you have greatly increased the chance of having a baby of a low birth weight. Smoking may lead to serious complications which could harm your body. Smoking when pregnant harms your baby, and that's a fact. Poisons in tobacco smoke reach your baby through the bloodstream. If you smoke when you are pregnant, you greatly increase the chance of having a baby of the low birth weight. This is a fact. And smoking may lead to serious complications and even harm your baby. Did you know that your smoking can harm others? Tobacco smoke causes cancer and poisons people. People who breathe in your tobacco smoke can be seriously harmed. Your smoking can increase their risk of lung cancer and heart disease. Think about this for a moment. Children who breathe your smoke may suffer asthma attacks and chest illness. Innocent children who breathe your smoke can suffer asthma attacks and chest illness. Why not just consider not smoking, getting some help? There's plenty of it out there. Help keep the world clean and green. Thank you.